Okay, let us start with the antihistamine topic. This is for TYB Pharmacy, Semester 5, Medicinal Chemistry 2, and unit number is 1. Now, before we move into antihistamines, let us first understand and recollect what are the different antihistamines that we are seeing in the doctor's cabin, in the medical store, even at our home. So many products that we know that. One is Corex, you definitely know this particular compound. Then Benadryl, this is what we are having, off and on. Then this is the Lock tablet. This also we used to have it. Then coming to next, that of the Avomine, and apart from Avomine, we also know about the Cetirizine. All these are the antihistaminic agents, and these agents are the regular products. Some are OTC product and some are the prescription product. Now, these compounds, these medicines, what we are going to do is we are going to find out that what sort of, or the entire study will be based on all these medicaments. Now, if we think about the learning outcome, at the end of this session, the learners will be able to, first thing is to understand histamine, receptors and their distribution in the human body. Thereafter, we will move towards the classification, that is the H1 antagonist based on the chemical nature of that particular compound. Then interpret the structure-activity relationship of different classes of this particular compound. Then study the chemical synthesis of few of the compounds that are there in the syllabus. And finally, understand the drug metabolic pathway, adverse effect and therapeutic value of drugs. So these all things we are going to discuss. Now, coming to the basic thing, the histamine. Histamine is nothing but a autocoid. Autocoid, it's nothing but the local hormone, we can say. Now, this is histo. Histo refers to the tissue, and amines, that is the amines which are released from the tissue, that we call it as the histamine. Synthesized. Now this histamine is synthesized, where it is synthesized from histidine to histamine, and it is stored in the mast cells. Now, what is its important role? Its important role is in the allergic reactions and even in the gastric secretions, even keeping persons awake. This is also important one. Now, the histamine receptors are present in so many parts. Now, there are three things: H1 receptors, H2 receptors and H3 receptors. I have drawn few of the organs, these you know completely, and these organs will find this receptors, that is the H1. First one is the H1 receptor, that is present in the smooth muscle, blood vessels, CNS, sensory nerve endings and in the adrenal medulla. Then the H2, that is the postsynaptic, gastric glands, blood vessels, heart, they are present. H3 presynaptic I am talking about. This is the brain presynaptic, lungs, spleen, gastric mucosa, and H4 are in the eosinophils and neutrophils. They are mostly present. Now, the mast cell contains this particular histamine. When antigen is acting upon the mast cells, it will release this histamine. Histamine, the first thing is what? The itching. Itching in the skin is because of this. Even the contraction of the respiratory vessels, the respiratory tract, is because of this histamine. Then the blood vessels to dilate and the gastric secretions, increase in the gastric secretions. These are the effects of this particular thing. And in the next lecture, we will discuss about the chemistry part of histamine. Thank you so much.